that you now have hypokalemia and they're going into lethal cardiac arrhythmia. So the RN priority is not the expected side effect of disease or treatment. You will not run to a wheezing asthmatic, they do that. You will not run to a pericarditis patient with chest pain, they have that. You don't run to a diabetic patient who has neuropathy. They got that. We do run though if it becomes acute and it's starting to affect airway, breathing, circulation. We do run to the unexpected finding. So we're going to be spending the next 3 days learning what are the expecteds and what are the unexpected. So you're not fooled on priority. Learning national scope of practice for delegation. We also will run our butts to that admission because that is a big black hole of I don't know what's wrong with you. It could be acute, it could be bad. And you better get your butt to the fresh post-op because in this lecture I'm going to be teaching you from every time I didn't go there. And what happened? Nobody died that I know of. Jesus. And you're going to say after 30, how did this chick keep her license? Move around a lot. It's like the witness relocation program in nursing, you know? Join a PAC state, just keep going from Kentucky to South Carolina, and they can't catch you, all right? I do legal nurse consulting. My name's not been on the list. I have been remarried, maybe they don't have a new name.
All right.
All right. Now, so this is very important. If you actually, I've had students that just with this information have been able to pass an exit exam. ATI, ERI, HESI, Kaplan, whatever it is. Just knowing this is the priority changes when you're practicing questions. Like tonight, if you go and practice questions, just do it. Say, man, is that an expected side effect? And you're not my priority. The next thing, too, that we got to analyze. Now, let me take a look. I have CO2. What's the first page of the book? First. Is one of me? Okay, for priorities, because I know I want to go over this, vasodilation. One of the things we have to do, and then you tell me where I'm supposed to be at again, all right, baby girl? Now, one of the things, because I go back to cellular depolarization and the patho. How many people here really liked A&P? Yeah. Well, anatomy and physiology, the nurses who really liked their A&P and really understood it, understand most of the signs and symptoms of disease. And I've taught patho at USF. I taught that for several years. And that's when I really started to connect some dots. Because I'm sure you've had master's and PhD teachers who can't answer a question for you. And you know, oh, it's in the book. I remember asking you, well, why am I paying you then? I got the book. I remember feeling that way. But it took a long time until I really understood A&P and patho and pharm to connect the dots. So my goal in these 3 days is to connect those dots for you. Now, and the people who were here before, be quiet. How do high CO2 levels decrease urine output? Where is CO2 made?
In the lungs.
It's excreted in the lungs. Where is it made? All right, we have a cell, and I want you to think of your cell as a car. And the fuel we put in that car is glucose. And the Krebs cycle that runs, making cyclic AMP and ATP, is your Krebs cycle engine. And the fumes that come out are CO2. So CO2 is made by every cell in your body metabolizing glucose. How does your body view CO2? What is it? It's an acid. Acid, acid, acid. Now your blood vessel, how do you think your blood vessel feels about acid flowing through him?
I want to get rid of it.
If you were a nice, smooth lining of a blood vessel with a great little intima lining, and you had a lot of acid in you, you would go, ah, 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 to get away from it. So high CO2 causes a blood vessel to dilate. When that blood vessel dilates, it drops blood pressure. When it drops blood pressure, it decreases renal perfusion. Without blood, can the kidney make urine?
No.
That is critical thinking. And everybody says, oh, you gotta critically think. But no one ever shows you how to critically think. Not one person. I remember telling the teacher, I can't be critical, I'm very positive. I had no clue what she meant, critically think. Not a little bit. So does this make sense to you? Do you see how you connect the dots with this? This is what we're going to spend the next 3 days doing. Patho, pharm, and connecting. If you have a DVT with a positive homins, can that give you a heart attack or stroke?
No.
Never, not once. Anatomically and physically impossible. So the nurses or teachers who told you that don't know their A and P. If you have a venous clot, it's in the venous system, and it's going to come up through the inferior vena cava to the superior vena cava, dump into the right side of the heart, go to the pulmonary artery, get wedged in your lungs, baby. So on a pick all that apply for DVT, you better be doing a respiratory assessment. Not just pulse, not just is it cool, hot, warm, is it swollen. You also want to be, and see, a lot of students wouldn't pick pain on deep inspiration. When we get to the PE section, when you have an alveoli and a capillary bed here and you take a deep breath, you're pushing more air against that blood vessel in there and it hurts. So the first sign of a PE is pain on deep inspiration. But no, it only took me 38 years. And being a nurse practitioner, an open heart ICU nurse, a neuroventriculostomy brain drain nurse, to get that. To finally say, why don't they just tell us that? Why don't we just figure it out like this? So the reason I have my website and the reason I'm doing these DVDs and the book is because everywhere I have gone in the US and Canada, nobody teaches you to connect these dots. And that is what I'm finding out I'm pretty good at. I didn't know that because I'm one of those girls that has a diagnosis of stupid, a real diagnosis of stupid. They used to do aptitude testing back in the 60s, and my mom got my test results. Why is this not clean? Test results. Can somebody go into the bathroom and give me a wet towel? Real quick, just a wet, so I can, because you know how many pictures I'm going to draw, and look, it's still staying. That's not good. So, make sure it's not permanent. I've done that before. My husband made me this whiteboard for my videos, and so I know the finish is good. It's probably that marker I was using. Now, I took an aptitude test, and I want to tell you the power of positive thinking when it comes to these exams. I took an aptitude test. My mom got my results back in the 60s, because back in the 60s you had to pass a test to know, do we put you in college prep high school, or do we schlep you into home ec and hope somebody marries your dumb butt? Okay? So my mom got my results, and you weren't allowed to take college prep classes if you didn't get a certain number. So my mom got my results on the farm. I grew up on a farm in Pennsylvania, milking cows, shoveling crap, the whole bit, making butter. Every day that manure tail slapped me in the face. I'm going to college. I'm going to college. If you've ever milked a cow, it's not the most pleasant experience. Now, she looked at that test. She goes, Diana, you can do whatever you want. Your results are off the chart. So my C's became A's. I did 4 years of pre-med in 2. Went to med school in Philadelphia and got knocked up, had to get married and rolled it all into nursing. But at my master's graduation ceremony, my mother brings this crumpled up piece of paper. She goes, I'm so proud of you. You've done so good for someone they wanted to put in remedial classes. She lied to me. She did say I was off the chart. She just didn't say in what direction. So that goes to show you, just by being told, you can do it. You can do it. We are all born with this equal, wonderful blank slate of a brain that is capable of anything we want to do. And then we have parents, boyfriends, girlfriends, friends, aunts, uncles, grandmas. Somebody makes us feel less than. And we believe it. And we buy into that we're not as good as them or as smart as them. And I'm telling you, I have a diagnosis of stupid, because if I'm doing what I'm doing, and I'm going to teach you everything I know, can't you be 10 times ahead of me in a few years? I will help you be able to be ahead of me, because that's my goal. I want you to be smarter than me. I want you to do it better than me, because I'm almost 60. I want to look up. What? It's the fat fills in the wrinkles. Why get collagen when God gave me my own? So I want you guys to know you can do this. I'm your cheerleader. There's a reason I'm calling that girl at 10:30. And she's in Detroit. Because somebody's got to know that, yeah, we'll get you in school. We'll run up your student loans. We'll take your money, and the minute you graduate, what the heck do we do with you? I have to help people. The only reason I'm here is because Miss Barnes was my student years ago. So I put my business, I put my reviews on hold for her and her students. Because that's what you should do when you really teach somebody. Don't you give a piece of yourself to them? I want to give you so much. You're going to say, I want this to be like a prayer meeting when we're here for 3 days. Because I don't want to just impart knowledge. I want to inspire you. Do you know what inspire means? It comes from the Latin word inspirato, and it means to be in spirit. And I don't care if it's to Allah, Buddha, Jesus, whoever. All right? It's in spirit. And that means to rise above what you think you can do, because you can do it all. All right? Now, what's my next in the books? So I'm on. We did the vasodilation. My pictures. Acid, well, I was talking about I gave the e-dilates and the decreased urine output. I want to go back to the questions when we get there. And what's the priority? And then, well, let's go on to cellular depolarization and how to analyze a question. All right? The main thing is, when you have a question, how many of you go for the question, you go to pick the answer, and you go, ooh, but what if? And you change it, and it's wrong. So what you got to view yourself as, when you're reading these questions, you're an SVU, criminal minds detective. Because that's what a good nurse is. You're taking assessment findings and clues, and you're trying to come up with what's wrong. So these people who write your Nclex questions give you everything you need to know in the STEM. You don't have to add but what if. All the clues are there. And how they do this is they pay people full-time salaries. One good Nclex question can take 8 hours to write. Because they're tying everything to it, and there's one little clue that makes it the right answer. So what we want to do is learn how to analyze these. You got to be smart like a fox when it comes to these questions. It's not all just critical thinking and knowledge based on priority. There are times when you have no clue. I've had students that goes, you have a cycloamine deficiency. You expect what findings? And the student's like, cycloamine deficiency? He's like, oh my God, this sounds like Ebola. This is something organic. I must have been sick that day. That's B12's real name. So one of the things that you got to do, you need to know for the Nclex, the real names of all your vitamins. They will not say vitamin C, they will say ascorbic acid. They will not say B12 is going to be cycloamine. And that's in that nutrition book area too. And then that's where some students are like, oh my God, it was that's what it was? Well, why didn't they just say so? So I'm telling you, you need to know those. They won't say, you have a 3-year-old who has a fever, what will you hold? They're not going to say aspirin. They're going to say salicylates. So they're using the real words, not the ones maybe that you're always taught or that you're used to understanding about. So that's why you want to take time to look at those real vitamins, okay? Let's do, the first thing we're going to do is whether you're going, you have a question, is it to do something, to do or not to do? This is where it's like positive and this is negative. To do something. You have questions that are just asking you to do something. What's your priority nursing intervention? What's your priority assessment? What's your priority teaching? You're doing something. Then you have the not to do's. Which order would you question? Which means don't do it, stupid. Which order would you question? If you had a pulmonary edema, CHF, would you question normal saline, D5 normal saline, or half normal saline? Half normal. Because it's hypotonic, we'll be going over that hypo, low, and goes into a cell, and it will make the edema worse. We don't really want to give them fluid, but if we're going to give them anything, it's going to be a hypertonic little mofo. We're going to give them D5 normal to suck the water out of the cell, and that's a concept we're going to go over next. So, how many times have you had questions where it says, you know this patient needs further teaching when they make this stupid comment? Okay, so, yeah, but you know they mean further, because that now is negatively stated. That is you're saying, okay, I got to pick the wrong answer. How many of you, though, miss those and pick a right answer? Because your brain is wired to go for the right answer. So what you want to do, you want to sit there and say, okay, if they're saying this is a stupid comment, like let's, a man has HIV and he's going to his daughter's wedding in California. And he doesn't want to carry all his meds on a carry-on bag, so he says, I'm putting them in my checked bag. Missing one dose won't hurt me. Well, that's stupid because you know they can't miss their meds. So right there you know that's the statement that he needs further teaching. But what are they going to do? They're also going to give you 3 right answers about HIV. And you always end up picking that because your brain is wired to go for right. So when you get one of those questions that says, you know they need further teaching when they say this, you will have at the Nclex a little whiteboard. You need to put a negative and say, pick wrong answer, stupid. And then, as you're going through, you say, but that's right with HIV. Oh, I'm looking for the wrong answer. That's right, so I can't do that. You have to remind yourself, because you know in the beginning you're looking for the wrong answer. Right? But, as we're reading the questions, our brain wants to pick a right one. So make sure you give yourself your own little clue. And then you can just, you wipe it off your whiteboard and move on to your next question. Okay? So the not to do questions have to do with questioning an order, questioning a lab, reteaching. So you're looking for wrong answers. In these, to do something, they're asking you to intervene and assess and everything. All right? Now, another thing we have to look for are key words. Key words. These are your clues. These are the clues, little CSIers. And key words are things like age. If I gave you a scenario that a woman is postmenopausal and has a BMI of 16, don't I wish? What disease pops to mind? What would be priority teaching? She's old and skinny. Osteoporosis. Let's keep the question the same. She's still skinny, but now we're going to make her 14 years old. What are you worried about? Anorexia. So age flips how you would think about a question. Does that make sense? So age is a clue, CSIers. Then gender. Because there are certain diseases that are more prevalent due to our hormones. Right? It's an estrogen-driven something. It's a testosterone-driven something. Timing is key. Timing. What, dear? All right? Timing. The first 24 hours post-op. You expect an elevated temp, don't you?
Yes.
Because that's part of the inflammatory pathway, part of your healing. Now, what about 48 hours after surgery and you have a temp?
Nope.
That, we gotta start thinking infection. The first 24 hours post-op, you will expect increased nausea and vomiting and decreased bowel sounds. Because the last thing to wake up from anesthesia is the tube, right? Now, 48 hours after surgery, if you have nausea, vomiting, and decreased bowel sounds, we are thinking paralytic ileus. All right, we're thinking ileus. All right, so then if we are looking at 24 hours above the knee amputation, we elevate the stump, don't we? But if we have, because we want to decrease edema. But if it's 48 hours above the knee amputation, we put it dependent to increase circulation. So timing is key. If you have someone who is admitted in the ER and they come in with 10 out of 10 abdominal pain, is it okay for them in the admission process of the ER to get round-the-clock pain med? Yeah. But what if in the stem of your question it said discharge? Should they be getting round-the-clock pain med?
No.
So timing has, and we don't usually look at those little elements, okay? Oh,
Well, the first two chapters, I went and changed all
okay. Just the
that, I
two?
changed the background.
So after the break, we have to,
No, the other ones I changed the background, so it's quicker, do it all at once.
okay. Now, the next thing, let me go ahead, thank you. I'll click and we will. Yeah, did everybody sign in, guys? All right, now, we kind of did this same thing. Is that my truck?
I don't have your keys. I don't think it's your
I don't know if you have my truck keys.
Yeah, it's like in your
Yes,
bag.
I don't know. No, that's not you.
How do you get
Somebody has a
this?
Honda?
Press.
Oh, somebody has a Honda down there.
Oh, no, mine's right here.
Oh,
It said it was a Honda.
well, that'll be entertaining on the film.
I was just gonna say
All right,
that. Did you
That's not yours.
did anybody have a slip from Derek to be cleared to be in here?
Other than the ones I already have, I got yours.
Don't erase these ones.
You have to go.
You just have to make sure that
Yeah.
that you're cleared to be
If
in
you're
here.
on the sheet, I'm gonna compare. If I don't have your slip.
Yeah, you just have
Right,
to,
please go
you have to
compare.
check with Derek.
You know what, Derek is not in, so that we.
All right, so we'll wait. Yeah, he'll be here soon. All right,
He said he was coming in early, so.
okay. So do we have this?
No, I'm getting it now. I'm almost finished.
What do you want me to do? Go yell at the car?
All right. Now, who would the nurse prioritize to see first? We already talked about thrombophlebitis with positive pedal edema and bounding pedal pulse. Well, we expect that, right? COPD with shortness of breath, respiratory rate at 18. What about scleroderma, cyanotic hands, +5 cap refill? What do you know about scleroderma? Goes along with Raynaud's. It's a vascular disease. It has a lot of vasoconstriction, right? So that's expected. What about a seizure patient on phentoin who has ataxia? And what about a chemo, someone on chemo with a white count of 2,000? That's expected. So somebody who's on a seizure, who has seizures on phentoin and they have ataxia, that's phentoin toxicity. All right? The first sign of dilatant toxicity is gingival hyperplasia. I always think of the movie Forrest Gump, Bubba Gump, when he says, "I just got big gums." So dilatant toxicity, the first thing is gingival hyperplasia. Then, if it goes up to 35, you are looking at ataxia. And I'm gonna go over depolarization and stuff, okay? You won't be able to walk right. Okay, this is gonna be fun, 'cause I have to sit
You don't have a way to play it?
I don't know, there's no, well, there's a little thing here that'll make you think there's a clicker, but there's no, this is the projector.
Alright, you didn't set it on a timer?
And I can't because of the way I talk. All right, so we talked about wheezing asthmatics, we talked about that not being our priority. We don't go to the patient with a white count of 2,000. You do go to the unexpected, you go to the acute, you go to the admission, you go to a fresh post-op patient. We already discussed that. Then the but what if. SVU detective needed. We do not add anything to the evidence of our question. Now when it comes to peds and OB concepts, when we're looking at things, when you're thinking about pediatrics, I want you to, we're going to be going over everything med-surg. Peds is just med-surg on little people who have immature lungs, livers, and kidneys, and we got to throw in Erickson. That's it. All the other things are the same, so we don't worry about them. That's med-surg. Asthma is asthma, okay? But when we have OB, don't you have 2 med-surg patients? But what's the only way you can assess if the baby's okay? Fetal heart rate. Because you can't ask him how he's feeling, you can't take a respiratory rate, you can't take a blood pressure. So if in doubt on an OB question, checking fetal heart rate shows you're assessing your second patient. So if in doubt, just pick it. 75% of the time, you're going to be right. Because it's showing you're being prudent checking on your med-surg patient, the second one. Does that make sense? And whenever you have kidney problems, guys, whether it's glomerular nephritis, acute nephrotic syndrome, whatever, you need to do daily weights. Don't the kidneys remove fluid? Daily weights, daily weights. If in doubt, daily weights. That is like 90% accurate. Mental health, the same rules apply, guys. When we are looking at a schizophrenic and it says, who will you go see first? And you say, oh, the schizophrenic who is hearing voices. Don't they do that? Expected. You don't run to them. Unless it's acute and they say the voices said get a machete and kill everybody on the unit. Jesus. Right? So, but if you keep in your brain that this is expected, every time they give you something, do these people do that? Okay? That's going to help you. Obsessive repulsive, excessive compulsives. Don't they always wash their hands? Don't they always lock the door 90 times? Now, if it's acute and they're doing something that's going to kill somebody, then we worry about it. All right? The rules of 60. We're going to go over the